Fellas, ladies and gentlemen, welcome back to In the Bushes podcast. I'm back on the mic after last episode. I took a quick little brief break as Chris decided to interview me, and I am extremely excited to have my guest on today. A man that has been on this podcast before, Brandon Young. Brandon, he looks a little bit different. No beard this time. So if you don't recognize him, that's why. And then a new guest, Dr. Doug, the man, the
Hello,
myth, the
hello.
legend.
Thanks for having me. Excited to
Um,
be here.
Guy's a legend, man. I'm telling you. Doug, the people that don't know you, obviously you run the golf performance side of stuff in here, and obviously it helps a lot of us want to be golfers, including myself. So we are very grateful for what you do in here. If you want to speak to a little bit on that and how you kind of got into golf and why you love it so much, floor is yours, brother.
Yeah, man. Started the golf performance and rehab portion of the business here a few years ago, and it's just stemmed from a passion of mine. I think now that you're retired, you could attest to it. You
Oh,
kind of
yeah.
run out of competitive stuff to do,
Yeah.
and it's an excuse to get outside. So that kind of is organically how it started, and got my doctor of physical therapy degree, and then try to mend my two passions there. And so
Did you like golf from like a young age? Is that something you've always done, or is it something that kind of just came up, or?
yeah, I was apparently really good when I was young, but gravitated towards other sports.
Yeah.
Played all of them, and then golf kind of took a back seat, and now it's back ever since once I started college, I started picking it back up again. So
Yeah.
it's good, man. It's a good
Cool.
sport.
It's a great sport. A very hard sport and a very frustrating sport, but a great sport. Also, something pretty cool about you that I don't know how many people know is you're one of the greatest paintballers of all time.
Oh my God, you
And
guys,
no,
you guys
so
exaggerate on this podcast.
no, we don't.
Jesus.
So I was first time I met. Well, one of the first times I met Doug, I guess we were talking, and he's like, "Yeah, I got a paintball tournament coming up." I was like, "A paintball tournament? What do you mean a paintball tournament?" So, oh no, dude, I travel with this squad, then we go to tournaments across the country, and we do all this, and I mean, the work that goes into it's actually pretty intense. So if you want to, again, you don't have to, but if you want to talk about paintball and your career and how it went and how much fun it was, go for it.
Yeah, I'll keep it brief. I mean, that's another sport I kind of gravitated towards when I was younger, and once you get pretty good at it, then you
Hmm.
start competing a little bit. You get picked up by a team at the local field, and that kind of cascaded to about 12 years of competitive paintball, and played at the collegiate level of the sport
That
club team.
I didn't know that.
Yeah, Cal State Long Beach had a pretty good paintball club team.
Really? Do you guys
Yeah.
travel for that or?
Yeah, we played the national collegiate event in Florida.
That's so cool. That's sick.
And then yeah, recently retired.
Hung it up.
Yeah, hung it up, man. Hung up the cleats.
Yeah,
Yeah, so
that's cool, man. Well,
yeah.
kind of getting into what we want to talk about today and why you guys are here. We got some of the best minds in all of baseball and all of physical therapy and performance in this building here. And I'm going to let them kind of nerd out today. It's going to be a very informative podcast. I want you guys to take something away from this. And we have a number of really important subjects that we're going to hit on and kind of hope to have you guys absorb some of this knowledge from these guys. So really happy that they're on and take some time out of their busy schedules because they're pretty busy. So I guess let's start with kind of the overarching topic that I think is so, I don't know, it's very interesting in baseball is injuries. So you don't think of baseball as a high effort contact sport, but yet you see guys get hurt all the time. And I guess kind of what I want to ask you guys, and because it's not just from the big leaguers, it's not just the high school, it's across all ages you see injuries, right? We see guys that come in here from 7 years old all the way up to 45. So what is it that kind of happens per age group, I guess, if you guys can? I know it's really hard to lump in certain age groups and certain injuries, but is there any information you can give them on that and what to look out for?
A couple points to add to that. Throwing is the fastest movement in sports.
Mm-hmm.
The losses from injury in baseball topple $4 billion annually. Staggering.
Is that on Major League Baseball or is that
That's across the board.
everywhere?
Maybe even higher.
Yeah.
But I think one of the keys that I've learned through the years, and the staff has also come to appreciate and learn, is that elbow injuries, 90% of the time, it's the symptom and not the problem. The problem exists somewhere else, and it's so frequently
Mm-hmm.
the shoulder. And you can look across the spectrum, and when the shoulder's addressed, the elbow does well. If you just focus on elbow rehab alone, and return that individual without looking at other joints to include mechanics, you're probably going to see them again.
Yeah. Is that something that you learned in PT school? Is that something that you've seen through experience, or is it kind of a combination of both, or how does that work?
It's a combination. In PT school, if we're evaluating the shoulder, we always had to first clear the neck.
Okay.
If you're treating an elbow or evaluating the elbow, you must first clear the shoulder.
Sure.
So it is a recurring theme,
Gotcha.
and we do learn that in PT school. Now, what I learned in my career, certainly school prepared me for it, but it's been a whole pioneering and journey of asking why. And I think we touched on that last podcast, is I am a why guy. Like, I always want to know why. Why does this work? Why doesn't this work? So asking why multiple times has led to treatments that we do here that I think are very unique and different, that are built specifically for baseball pitchers,
Yeah.
throwers.
No, absolutely.
Yeah, he did all the hard work, and then he trained me, and so it's been good. And then to further your point, by age group, that's kind of a good point to bring up, because there's almost different risks for different age groups, right? For the younger adolescent, we're dealing with something a little bit less serious, like little league elbow, little league shoulder, growth plate injuries like that. But then there's also something very significant and that you don't want to miss, and osteochondritis dissecans, OCD. Those are things you can't miss, and those are only found in
Not
the
the
younger.
OCD, like the.
Osteochondritis
something different.
dissecans.
Okay.
Yeah,
Gotcha.
sometimes need surgery, but if you catch it pretty early, you could do some conservative treatment. And then from there on, then you get into the high school athletes. Then you get into more soft tissue injuries, UCL,
Like repetitive type stuff.
repetitive type injuries, and then that carries over to the collegiate and the pros. But that's kind of like a broad paintbrush of what we see here all the time.
Yeah. What do you guys usually do? And you kind of touched on it with the OCD, and it sometimes requires surgery. But for a young kid, that comes in with that little league elbow, what does a treatment protocol look like? Because I know you think about doing PT for a young kid, and a lot of people will be like, he's 8, he doesn't need any physical therapy. What would you guys do for that?
Yeah, so I could touch on that. It's I always like to think that kids don't lie. They might lie to their parents and stuff like that, but when something hurts, it hurts. And so when someone younger comes in, anywhere from 10 to 14 is kind of like the big ballpark there. Is all right. Like, how much pain are we dealing with, and does it hurt with a lot of stuff? Because upon exam, if I suspect some little league elbow or shoulder, man, almost everything is painful. And that's weird, right? It's either, I look at it this way. It's either they strained every single muscle that surrounds their elbow, or they have a little league elbow. And step number one is get an x-ray. Let's find out exactly what we're dealing with, and then we'll proceed accordingly once we get a picture of it.
Sure.
And that's kind of the proper screening with everyone at that age.
Yeah. What about as far as like the high school, college guys, how it's more like that soft tissue type injury? And obviously, everyone goes through different things and has different injuries and different symptoms and all that. But, is there too much soft tissue work? Because I see a lot of guys that come in and they're constantly foam rolling the same area. Is that something that you guys watch out for because you want to overuse the tissue, or like what is kind of the protocols when it comes to that?
Yeah, well, soft tissue like that, I mean, there could be some overuse, but I'd look at it from a different way. Massaging, massage gun, the cupping, that's not going to increase risk for injury. Really, soft tissue gets overloaded, especially in these baseball athletes. They throw a lot, they throw hard.
Yeah.
If they're good, they throw more, right? And so you could see how that could lead to some overloading type injuries, overuse. So the soft tissue stuff that you touched on, that could be really good for recovery and things like that. But
so in that question, were you asking if watching someone do soft tissue constantly kind of brings our awareness to maybe something else is going on?
Yeah,
or
part of it, yeah.
Or is doing too much soft tissue work?
I think a little bit
bad?
of both, to be honest with you.
So yeah, if we see someone constantly rubbing their bicep, constantly picking at that area, obviously something's going on.
Sure.
And like we touched on earlier, it may not be the bicep. I mean, that could be the shoulder.
Like a downstream effect.
It could be TOS. It could be so many different things that, you know, time and treatment rule out or rule in.
Yeah, we see we can talk about TOS a little bit here in a minute, because I know it's such a interesting diagnosis for you guys, and we've seen some guys with it. But I wanted to ask too, Brandon, you've seen so many guys come through here, younger kids. Hey, I went to a tournament. I threw on Friday. I took a break, but I played center field on Saturday. And then on Sunday, we were in the championship game, and coach needed me. I needed to throw. And that I've seen that as young as 7 years old, 8 years old nowadays. What would you tell those parents or coaches to kind of give them some advice and some brief science as far as, hey, probably not the best idea to overuse the arm right now, especially at a young age. We're not in the World Series. Let's kind of back off. What would you tell them?
That is a great question, and I hate that.
Mm-hmm.
And I will take a little time to explain that for those that need to hear this.
Floor is yours.
So bone and soft tissue, they have their tensile and bony strength, right? Compression for bone, tensile strength for tendons and soft tissue. And we go by Wolff's Law for bone and Davis's Law for soft tissue. So Wolff's Law states that bone will remodel itself stronger if it's given the appropriate amount of recovery time. So an example would be maybe someone that's doing jiu-jitsu that wants to make their shin stronger so they can withstand kicks. So they kick the topo pole. You know what I'm talking about?
Yeah.
They would do that in the past, but they had a load recovery system in place. So you can't kick that thing every day.
Oh.
They kick it, they'd be sore, they'd let it remodel, they do it again, and they end up having rock solid bone and shins, right? But if you don't have the recovery time, that bone will get weaker. Same with soft tissue. If you load it in a tensile way, it's good as long as you give it time to recover and you don't go past its current parameters. So
Sure.
Throwing is a perfect example of loading the bone and the soft tissue. So let's say in your example, Friday there's a tournament and little Jimmy pitches. He throws 50 pitches. 30 minutes after he pitches, his body is going to start this process of breaking down. And so is the soft tissue. So soft tissue bone will begin a breakdown process in the line of stress. The next day, maybe that night, it continues to break down. And once it's fully broken down, now it's going to start replenishing that area stronger.
Mm.
That may be a 3-day process.
Is everyone unique with that, you think? Is there?
Oh, it's very different across the board.
Yeah.
And that there's another why. Like, how do you find someone's load and recovery time frames? I mean, there needs to be a questionnaire. There needs to be history. Like, how sore are you the next day? What do you feel?
Right.
That can start to help understand the athlete's recovery. Sleep, nutrition, all that plays a role. How much they throw, how conditioned they were from prior seasons or even the off season. Did they throw leading up to tryouts, or did they just come and try out?
Yeah.
And there's high risk when the body's not conditioned. Let's say you haven't bench pressed in 5 years and you go do a full workout. You're going to pay dearly for it.
Oh, yeah.
You continue to do that workout within 4 months or much less than that, right? It doesn't even make you sore anymore. So there's your load recovery example. Of course, that's muscular, and that's a lot just looking at tendon and bone. But a lot of these kids will pitch, and then the next day maybe they're the best center fielder or the best shortstop. So they're expected to perform fully at that position while their bone and soft tissue may be in a breakdown process. And then pitch on Sunday, you just a lot of insult there.
Yeah.
And if you don't give that recovery time, you can end up in a maintenance phase. The risk of injury increases. And look, if you're an adolescent and you pull that growth plate off, there's no guarantee it's going to heal anatomically correct. You think in a 3D model, you pull the growth plate off, it's going to turn or rotate.
Sure.
Your ulnar collateral ligament may be on that piece of bone. Now, you've changed your ulnar collateral ligament from that day forward, or your shoulder, your growth plate there.
Yeah, that's a lot of great information that a lot of people need to hear. So I'm glad that we can get that out. You kind of touched on this, and Doug, I want you to speak to it as well. Why is it that a lot of pitchers seem to get hurt when there's a long layoff? Why is that? What causes that? I feel like I see it more times than not when it's like, oh, I took the fall off because I threw a lot in the summer and spring, and then my shoulder just started barking. I don't know what happened. What is it from a physiological standpoint that kind of makes that happen?
Yeah, so it's deconditioning, right? And then reintroduction to sport too early. I speak in analogies sometimes. I think something that I explain a lot is imagine if you're a runner, all right, and you've gotten in really good running shape. You're training for whatever race it is.
Mm-hmm.
And you're able to tolerate 50 miles a week, right? And then you're like, you know what? Winter months, I'm gonna take it easy. No
Sure.
running. And then March comes around, right? And you come in like, oh well, I tolerate 50 miles in November per week, right? So let me try to go right back to it, man. Something's gonna give. And I feel like when you paint a picture like that, a lot of people understand.
Mm-hmm.
And it's just reintroduction to sport too early. And the baseball athletes, hey, I finished fall strong. You know, I tolerated 80 pitch games, and I was able to pitch twice a week. And okay, February comes around, and
Yeah.
okay, well, and then it's just not conditioned. So a proper ramp up phase and a maintenance phase for arm conditioning is super important, just like running.
Yeah.
You could deload, right? But I think the thought of taking months off at a time for anything, running, throwing, lifting, anything like that, and then reintroducing too quick, that's an issue.
What's the maximum amount of time you think guys can take off from throwing?
Me personally, I don't think they should.
You think it should
I
be
mean,
an
if
all
they play
year?
catch, doesn't mean it needs to be max effort.
Yeah.
Hear me on this. It doesn't mean you're pitching and competing,
Mm-hmm.
right? But
That was important right there.
based on Wolf's and Davis's law, you want to keep conditioned.
Yeah.
The bone and the soft tissue will respond well. Don't tax it. Have a regimented load. We can build those programs for you guys. We can build
Yeah.
an off-season throwing program for anyone that will keep them conditioned and healthy. And the other thing is when you take time off, we're going to use the shoulder as a basically focal point. A lot of guys will come back with posterior capsule tightness or a contracture.
Sure.
So, and the capsule basically dictates how much or how little we can move. For a pitcher, the anterior capsule gets loose, that's your layback, whereas the posterior capsule gets tight because they're not using as much range, and that becomes a capsular shift. When the off season, it gets tight, thickens, and now what's called your shoulder arthrokinematics are off. Now you're susceptible to internal impingement. We see that a ton. Guys coming off Leo, we got a little fly action over there.
Yeah,
man,
he's playing it off well.
It's getting me.
He's been playing it off well over there. I've been watching him fight this thing.
Did you win?
Nah,
yet.
it disappeared.
Not yet. He will.
So, yeah, that's a really good question, and we do see a lot of guys have come back, and within the first week or two, they've got shoulder problems or elbow problems, and the list of stuff Doug gave you, as well as the capsular contractures, etc., are all playing a role.
Yeah, and on the other side of that coin too, right? Finish in fall, and then okay, I'm gonna keep up the 2 bullpens or 2
Mhm.
like hard effort days per week. I mean that's too much also,
lot.
So
Mhm.
it is a delicate balance, like Brandon touched on.
So-
Very important.
So, kind of going from that younger age, then you got guys in college that are throwing every day. They have to be ready to pitch on the weekends. And then we take that a step further, you go to pro ball. And let's say in the big leagues you're playing 162 games. I've seen relievers go 3-4 days in a row at times. How do you combat that, what you guys just kind of hit on? How do you try to maintain throughout a whole entire 162 game season as best as possible when basically you're just getting broken down for 6-7 months at a time? What is it that we can do to help those guys stay healthy as best as possible? And I know it's not a perfect science because it's damn near impossible to keep somebody healthy that's throwing a ball 95 miles an hour all the time. So what is it those guys can do? What have you guys seen in the past? Just go ahead and briefly talk about that.
So it's a whole load recover phenomenon, right?
Mhm.
It's not a phenomenon, it's basic science. But pros obviously are different than college. We've touched on this before when you came. You're a different animal. You could tolerate throwing like I'd never seen clients before. If I'd have put other clients through what you were doing, they get hurt. And what you did through years was you've built your recovery time. Your body knows I have to do this, and you've taught your body and taking care of yourself. You've always watched your nutrition, sleep. You take really good care of yourself. So you've trained your body to be able to recover quicker. And we talked about that recovery time is we don't have a crystal ball for it. Mm-hmm. But pros have trained their bodies to do that load recover process a lot quicker than others. Even college guys can't withstand that kind of load,
sure.
or a lot of them, or it catches up to them. So it's a regimen of training like what you've kind of pushed for here is like, look, these guys can't take 2 or 3 days off to recover. That's a perfect world.
Mm-hmm.
And it changed the throwing program this year to try to speed up that load recovery process.
What did we do this year? And I loved it because I think there's a lot of research out there that says like you need to build some sort of endurance stamina before we can start to have gains basically in velo. And I thought a lot of the guys responded really well to that when we kind of had the 2 sets of, I think it was like 25 throws or whatever it was. A lot of the guys came in, were like, what in the heck is this? I've never done this in my life. And I would say the vast majority, if not everybody, like really enjoyed that throwing program because it was so different and it made them feel so much better throughout the off season. What made you come to that? What was the research behind that throwing program? Yeah, why'd you come to that?
Because of you.
Oh, thanks.
Because I don't like that.
Yeah.
Right. But pro baseball is not going to change because Brandon doesn't like it.
Mm-hmm.
This is the world, and you have to adapt to that world. So you've said if these guys relieve, here's what it's probably what they're going to have to do, and we have to get them ready for it. So I designed that program based off of your feedback to me, and it's time to get on board with what the pros have to do.
Yeah, and everything's radar guided, by the way, too, which I think is very unique and very important to what we're doing.
That's a good point. So our throwing programs are all radar gun guided, so we know the exact load, and then we can progress them academically, not guessing. They're not just playing catch blindly. They're playing catch with a documented average velocity, and then we know what their next outing should be. I think some of the pros, or if not all of them, threw too hard, too fast.
Yeah,
that's a different bull right there.
Mm-hmm. A lot of those guys are so competitive, and you have to almost bring them back because it's, the radar gun's out. I got to beat that person I'm playing catch with and myself. I gotta figure out how to throw harder than what I'm doing now. So it's like you said, double-edged sword. But I think once they bought in fast, and
the feedback was good,
really good. So really cool thing that we do here. Doug, what do you, as far as a throwing program goes for somebody coming back from injury? I know we kind of touched on the radar guided throwing program. How important do you think that is for guys?
I think it's very important, and arguably maybe the most important part of rehab. Maybe just second behind a correct diagnosis.
Sure.
And finding the root of the problem. But once they're cleared to throw and their arm is deemed healthy based on our exam and our tests, then if you just got to progress the load. It's that simple, and when you stress it, you got to have some recovery time. And you do that over weeks, you do that over months, you keep on building, you get a pretty good product at the end. Problems arise when athletes kind of steer off of the program, and they start messing with the load recovery time.
Yeah.
And it's as simple as that, but it's more complex than that in the same sentence because we're dealing with some competitive athletes, and
mm-hmm.
they're seeing their friends compete, and when you get injured and you have to sit out, man, it's
tough.
Maybe the hardest part is the mental side. So
sure,
staying patient and all that stuff is very important, and can't stress it enough.
Yeah, there's a few guys that come to my mind as far as who was throwing too hard too early, and you know who you are, so they'll listen to this.
Yeah, we know who you are too.
I want to shift kind of into neuromuscular control. I think that's a very untapped realm of development, and I want you guys to kind of give me a broad umbrella statement of what neuromuscular control means, because you think of an athlete, right? You think strong, you think fast, quick, all those things that come to mind. You don't really think of neuromuscular control. That's not a term that a lot of people hear or think much of because it sounds too big of a term. Give me a broad statement of what it is and why it's important for pitchers and athletes as a whole.
So being able to stabilize and control your body and make it do what you want it to do.
That's a broad stroke right there. Yeah.
What do you got, Doug?
Well, yeah, that's a perfect broad stroke, honestly. And then and one thing that I would add to that is we've seen with these athletes, they could do a drill over and over again and nail it,
Mm-hmm.
throwing into a net, whether it's a plyo ball into the wall a few feet in front of them. And then it was time to throw at 60 feet. Things kind of, yeah. And so that transition is kind of the harder part where neuromuscular control kind of comes in, and it's hard to do.
Yeah, it's extremely hard to do. And I've seen, and I think I've actually hit on this in a previous podcast, but there's a couple guys in here that you go and ask to do a finger roll layup, and it just does not look pretty. What does that have to kind of do with, but like you said, Doug, like you have them do a plyo drill and it's, okay, boom, you got it. It's easy. Is that something that kind of stems from not playing enough sports growing up? Is that just a untapped motor learning pattern that they didn't have or they haven't had in the past? And can you teach that?
Yeah, it's like, can you teach an old dog new tricks, and then overall athleticism about how pretty a finger roll looks. I mean, I bet you, if they just didn't play basketball and when they're younger. And so I get what you're saying, though. I think a lot of exposure to athletic movements is very important just in the long haul, especially when things get a little bit more complicated when you're trying to, like fine tune a very complex movement like pitching.
Yeah.
So it'll only help.
Yeah. And I wanted to ask too, because it's a very interesting topic, is learning and how the body learns and how we can put all the drills and all the stuff that we do. And Doug, you said it really well. You can be perfect at a plyo drill, and then all of a sudden it all hell breaks loose right when you get on that mountain, 60 feet, 6 inches. How, because, in my experience, you see a lot of good progress being made from certain drills and, you can see it incorporate. But at the end of the day, I feel like the athlete still needs to do it. So what is it? How do you train the neuromuscular control aspect? How do you learn new movement patterns? What are some of the things that you guys have seen going, in here that can help guys learn at a faster rate?
I'll throw some neuroscience at you. Thanks. Shout out to Dr. Huberman. Neuroplasticity is really where the brain organizes itself and creates new connections so you could learn something, whether it be something in school or a movement pattern like we're talking about. It happens when you're sleeping. Okay. And so what you touched on earlier about all the other things outside the physical realm, the diet, sleep, and things like that, sleep is utmost important. And then on the other side of that, I mean, reps, like dry reps and maybe not even throwing a baseball, things like that. You kind of blend those two, and just some good old-fashioned hard work, man. The reps.
Yeah.
Learning new motor plans, pathways. I've always instructed a little different. Chris has learned my old style, and he knows that, but he's also incorporated a lot of drills, which I was never big into drills. When I did neuroscience and neuroanatomy, it was more part versus whole movements. A whole movement would be walking, and part of a movement would be maybe heel strike to flat foot. All right. Mm-hmm. So if you did a drill trying to incorporate it into the whole plan, which is walking, and you just did heel to flat foot, and you expect that to then translate to walking, doesn't work. So for years, when I did pitching instruction, it was always on a whole movement plan type thing. I would make them do something that would create what I wanted.
How so?
So if it's timing of the arm, I may cut out their leg swing and then impact the timing up the chain. So by putting a bucket there, I mean, they're not thinking about their arm at all. By putting a bucket, blocking them from swinging their leg out, now we have the foot getting down faster, and it affected counter rotation upper torso as well as the arm. So but with that one drill, I addressed mechanics and timing up the chain. That's a whole versus a part, where maybe I would pull them out and say, here, I want you to land in this position, feel your arm here on time, and throw from there. That would be a drill, and then I would expect that drill to show up in their mechanic. There's the difference. I always trained whole, never part or drill.
Gotcha.
And when the occasional time where I come out of retirement and work with somebody, that's what I do. Still.
Come out of retirement.
And it worked,
Yeah.
But Chris took what he learned from me and also that he's developed on his own, and additionally learned from Kirk Goodson over at Backward K, one of the best pitching coaches.
Yeah, he's fantastic.
Coaches, human beings, period.
Mm-hmm.
We've collaborated with him a lot, so it's come a long ways. And of course now Grant is bringing his own flair and doing a great job.
Flair.
So
Great word to describe.
Learning from Chris and me a little bit, but mainly Chris. So it's a long path to answer that question.
No, I'd be as detailed as possible. I think learning is a very complex process for that humans have to go through for just about everything. So
every movement has a blueprint.
Yeah.
Walking, jumping, pitching, and it's that motor plan is stored in the premotor cortex. And so when you recall that plan, you will execute it almost perfectly.
So how would you describe somebody that's just that guy that's naturally gifted that you hear about all the time? But from a young age, they were just better than everybody else. What is that? Is that just an innate thing that they got? Is that genetics? Or is that a combination of just about anything?
You'd have to imagine that guy watched a pitcher and maybe envisioned himself moving perfectly and could take that vision and then make a motor plan and execute.
That's what I've seen with guys too. It's like the ones that are really good watch a lot of baseball and they try to emulate guys. And I feel like you can learn motor patterns through that too without even really realizing like, oh, I'm going to go watch World Series. I'm going to watch Verlander throw. And all of a sudden they come in doing his thing. And then, dude, you're pretty good, and that happens a lot of times. And how they're emulating these athletes.
It's crazy how many people come out of the 3D review. So the 3D review, I go deep into mechanics. And I not only go over their results, but I teach them about mechanics. So when they leave, we're speaking the same language.
Sure.
They understand. It's not just a report with lines and a prescription on it. I go into detail. And we've seen so frequently people come out of the 3D. Now, we haven't done any individual work yet, but come out of a 3D and throw harder. Just because they've processed it and then have made it part of that motor plan.
Yeah, it's pretty cool. No, I love seeing that, and that has happened. And when people can learn that way, it's pretty special, and I think that makes for the best athlete. All right, let's shift gears a little bit. I want to talk about strength training, exercise prescription, and why pitchers are so different than everybody else and what's important for them. And Doug, you put on a really good meeting the other day, and we've done some really cool testing with our Proteus that kind of backs our findings and backs what we've done, which is great for me. And I know our strength and conditioning guy, Matty D, was
Matt D.
He was thrilled
Matt
about
D.
that. Where's Matt?
He's working out, I bet.
Yeah, he's working out. Our strength guy likes to lift. That's important. We'll have him on soon. But anyways, Doug, I want you to kind of give a brief overview of what we talked about, and just a little reminder, it was kind of about the hypertrophy, the strength power, the proper phasing for guys, and what's important. So if you don't mind kind of giving a brief rundown of how that presentation went, what do you got?
Sure. Yeah, and it starts from the top down, looking at we're focused on pitchers, what pitchers really need to be successful, right? We're dealing with a powerful athlete that has supreme mobility, explosiveness, and stability, right? I mean, that's kind of the nature of it, and that's kind of broken down by body parts, right? We need certain things in their shoulder, we need certain things in their elbow, torso, T-spine, hips, you name it, right? So I'm kind of looking at what the athlete needs and then determining a game plan from their training program from there. And luckily, we have tons of awesome equipment in here to really give us a real answer. Because what we've seen over the years is that all athletes are different. We can't give athlete A the same thing we give athlete B, and so on. So
Sure.
That's kind of where this is coming from. And pitchers, they're dealing with anaerobic exercise. It's can I do something as hard as I can, and then do it again 15 seconds later, and that should kind of be your sign on how programming should be, right?
Sure.
And so they're doing a lot of explosive training, strength training, incorporating some power, but then also they need some endurance too. So that kind of breaks down from the top down, right? And
that's not just like running. You're saying like rotator cuff endurance and things like that.
Yeah, correct. I should clarify endurance from a muscle standpoint as opposed to getting out and
jogging.
Running 5 miles. We don't like that here.
No,
we don't like that here.
No.
That needs to die. That needs to die.
So you heard it here first.
Yeah.
Poles need to die.
Poles need to die.
No.
Yeah. I think that's a thing coaches give out just when they don't know what to do.
Yeah, that happens a lot.
Yeah. And so, yeah, explosiveness is kind of the main thing. But then when we have our off-season beginning and our off-season training program, we actually have some time. So stage one would be if they're kind of deconditioned because the season's long and maybe they're throwing more and doing more field work type stuff and maybe weren't in the gym too much. We do a little hypertrophy phase, translates into a strength training phase, and then from there it's power. And that's where the athlete needs to be. And then beyond power, we need power endurance. So not only can you max effort, like rotate on the Proteus as hard as we can, but how many times can you do it at a high level? As of course the pitch count increases and things like that. That is where our end goal is for all of these guys. And then there's within all that kind of focusing in, we got reps and set ranges. There's some things that you do not want to do with these guys if you're actually trying to become more powerful and explosive. And there's things that you should absolutely do, right? And that goes into the 3 to 5 model for power and strength, right? 3 to 5 reps, 3 to 5 sets. They recommend 3 to 5 minutes between sets of rest, right? And
that's just to recover optimally and
let the body
movement.
cool down, right? Because when you're training max effort, you need the recovery time to actually train max effort, right? That's the whole point. And you can do that 3 to 5 times per week. So once the athletes are at that phase, that's where we're going.
Yeah. And I thought it was pretty cool. One of our athletes, came to us and one of the twitchiest freak athletes, that I've seen, and just wasn't very strong. And we incorporated a lot of the strength stuff, and it was cool to see on the Proteus, and you guys can speak more to that, why we use it, how we use it, was able to back up what we were doing and improve a lot of his numbers. And we got a really detailed report from those guys. Proteus is great. We were able to identify that, hey, we actually did some cool stuff. How does that testing work, and why is it so important?
Yeah, Proteus tests power output. Power is just how fast can you move a force, right? So you could increase power by 2 ways. You could increase the force, like kind of from a strength perspective, or you can move it faster. And the idea is we want kind of both, and what the Proteus does, it calculates all that. And so we go and test certain athletes from the top down. We like testing the shoulder and of course the rotational muscles, and get some whole body movements in there just to see how efficiently they could rotate and things like that. And we get it right when they walk in and start the training program, and then we could test them when they leave. And all of the athletes have progressed in that manner. And the good thing about the Proteus is it paints such a clear picture on what the athlete needs to work on.
Yeah.
And we like to do it periodically, once a week, maybe even more than that, or some people, every 2 weeks, something like that. But just to track progress and to see what works, what doesn't, and they've all progressed in that area so far this off season.
Yeah, that's really cool to see. Go ahead, Brandon.
This is a nice shout out, and everyone can comment on this, there's been a lot of feedback that the Proteus can't touch what our therapist can do manually with the shoulder with the Isokinetic 6. So that's a shout out to the therapist. Bobby, would you agree?
Yeah, the resistance that you get just from another human being, I feel like, and maybe it's, I don't know. I like the way that it feels as far as doing my shoulder manual work with another therapist, and obviously that's not the only thing that Proteus is used for, but that just kind of is a testament to these guys in here, and Brandon, how you've shown them the way as far as how the BY6 goes, and that's one of our prescriptions as far as post throwing is shoulder manual routine that I think is by far and away one of the best things you can do. At least, speaking from my experience, I was somebody that really craved stability in my shoulder because I was already pretty mobile. So that really was something that made me feel great after my outings or after my bullpens.
That's good. I did want to nerd out heavily. I wanted to talk a little bit about some of the brief exercise prescriptions I did before we had all of this, all these minds, Matt, D, Bobby doing the programming, bringing all this stuff full circle. So back when I just did 3Ds and then we did the biomechanics follow-up, I would give an exercise prescription. It was very blanket, very general, but it would get amazing results. And I'm going to say a couple things here that should create some controversy, but they're truth for the last 20 years. Almost always when kids have trained sprinting and verticals, their velocity has seen a direct correlation upward. I have not seen the same with squats and deadlifts. And I know there's a lot of people that are listening, and if that's you, you're not alone. You know, they get stronger, they put mass on, their squat went up 100 pounds on max, but they gain nothing on the radar gun. You are not alone. So I'm going to tell a little story, and I've been applying this for years, and I've seen excellent results. Kobe Engel, I just talked to him today. When he was in high school, I think junior year, he came to me for a 3D, and his instructor was Kirk Goodson. Obviously, this kid looked impeccable on a 3D, which is not very frequent, but Kirk had worked with him, and he just looked phenomenal from a mechanical standpoint. And I said, Kobe, what do you know, he was 84 to 86 at that time. I want to say it was early January. Kobe, what are you doing strength-wise, power-wise? What is your exercise prescription? Squats, deadlifts, bench, traditional stuff. He said, I've gotten a lot stronger, but I've been stuck at 84, 86. I said, you're not alone. We see this all the time, and a lot of times we'll see guys go off to maybe an organization, put on the weight, and lose speed. It's not uncommon. But what are you doing? And he, of course, he was doing the traditional stuff. I said, stop doing that. For 4 weeks, you look perfect mechanically, so I don't have anything for you there. Mm-hmm. But I want you to stop lifting, and I want you to do this sprint program for 4 weeks. So he came back 4 weeks and was sitting 90 to 93 in that bullpen and maintained that. Looking at possibly being drafted, he was already committed to state. You know, hearing agents, et cetera, telling him that he needed to put weight on, he put 30 pounds on. Velocity started suffering. Once he took that weight off and got back to the sprinting, velocity went back up. I just talked to him this afternoon. I said, hey, Kobe, is it okay if I tell you a story? He said, no, I want you to. He said, just so you know, for the last 3 weeks, I've been doing that sprint program again, and my velocities went back up. So it's just a hard grain to fight when, in terms of just going to lifting. And I'm not saying squats and deadlifts are bad. They need to be phased. They have their appropriate place, which is what Doug touched on. Mm-hmm. They have their appropriate place, and probably it helped Kobe build what he needed. We needed to take that mass and make it move fast.
That's it right there. Move it fast, man.
Yeah.
And
And then up the chain that goes. That's why sprinting and vert have worked so well. Mm-hmm. And you know, Kobe's a testament to that, but I have several other kids that have improved. Now, why does that work? Why does sprinting work? Well, I think there's several reasons. You know, I'll just briefly touch on hip-shoulder dissociation. When you're sprinting, your torso and pelvis are moving. They're dissociating, which is what you do in pitching, and they're doing it at a very high rate. So your nervous system is doing that. You know, it's firing. So you're training your nervous system. You're recruiting the type 2B muscle fibers that you need, which are fast twitch. Mm-hmm. And the main thing you're hitting on is the anaerobic phase, which pitching is anaerobic. It happens in less than a quarter of a second. It is anaerobic, and then you get the ball back. So when we're trained pitchers, it needs to be quick and powerful. That's what the movements require. Well, if we continue to ask why it works, anaerobic just means the absence of oxygen, all right? And there's 2 metabolic pathways that you really should understand if you're giving exercise prescription. The first is your phosphocreatine pathway, all right? So you're basically, the powerhouse is ATP. That particular metabolic pathway just passes a phosphate onto adenosine diphosphate to make ATP. It's a quick hitter, all right? And then you'll move to glycolysis, anywhere from that 5 to 15 second period, all right? Then what you're doing is you're splitting glucose to make 2 ATP. 1 molecule of glucose makes 2 ATP. But there's a byproduct called pyruvate, and that's where your lactic acid comes from. Okay, there's, you know, that byproduct's going to create the muscle fatigue. Well, what we've learned is that we can delay that fatigue, called your anaerobic capacity, right? We can push that bar back by doing the right exercises. And we do see great gains when we write prescriptions to address that. So what's your anaerobic power? What's your anaerobic capacity? If you're a pitcher, you should know that. And you should definitely be doing a program that challenges that. Sprinting is is a fantastic way. The prescription for Kobe was 30 seconds, all you got. 4 minutes to recover, repeat that 4 times. Do it on a track so you don't roll an ankle or do something crazy like that. In 2 weeks, this is research, just not me pulling it out, you can increase your aerobic power by 10%. You're going to see that in a fastball. I think if you're going to divvy in mechanics and medicine, exercise prescription, you should know it to the organic level, to the molecular level. I love nerding out to that level. You know, that's where a lot of these things have come from that have been put in place. It's just understanding it to that level.
Sure. No, I love it. I think the more in depth that we get about these type of things, the better. You know, I think people hearing you say that is massive. And I think you guys both said it perfectly as far as it has to be phased properly, right? And you see a lot of these kids that get stuck in this strength protocol that they never kind of get out of. And then all of a sudden, hey, I'm not moving very fast, you know, and we have that huge hill here that I hate, but that's a staple as far as our programming goes. And, you know, when you're in-house to be running that. And there's a lot of research too that I saw as far as like HGH goes too. I don't know how much you know about that. I just read a study on it, so I don't know if I'm accurate or not, but there's something about sprinting that can actually increase HGH, human growth hormone, after you do it.
Wow.
So I don't know. I look it
I
up.
wount doubt it. And that's why you ask why.
Sounds good to
That's
me.
why you ask why.
Always ask why.
Look, guys, pyruvate lactic acid is not a bad thing.
No.
It's a great thing, and it's when you know you're hitting that anaerobic pathway.
Yeah.
And when you can do the same workload and that's less and less of that, you're trending in the right direction. You just need to find a way to continue to push that.
Yeah, and one thing too, since you mentioned glycolysis, I'll nerd out a little bit. That just means you're breaking down glucose, right? Using it for energy.
Yeah.
And when we have pitchers coming in or for rehab or even for a pitching lesson, or even more so when they're competing, man, if you don't have enough energy in your system via diet, man, it's no good. You're training anaerobically, you're competing anaerobically, but you don't have the blood glucose or the glucose that's just naturally stored in the muscle cells, man.
Sure.
It's so true.
It's very important. And you know how it is when these athletes are, you know, it's just very important, I think.
Yeah.
Yeah, you listen to this podcast, you know, and we're talking about what you're breaking down to power your powerhouse, throw the ball. I mean, you should look at this stuff and understand the diet and, you know, what's going to fuel this. Whole grains, fruit, vegetables, like what's their role? I'm not going to say it the next phase because a lot of people are already there, but it's important stuff.
No, absolutely, guys. Thank you for taking the time to do this. I really appreciate it. Guys at home, I really hope you learned something from this. I love doing these type of podcasts because I think they're the most important ones. Somebody takes something away from this that's going to help better their career and help better their just life as a whole. That brings joy to me. So I really appreciate it, guys. Is there anything else you want to say?
Yeah, why is this a podcast called In the Bushes?
That's that needs its whole episode, brother. But
In the bushes.
In
You know
the
what I
bushes.
think of when I hear that is you know that like that video of Homer Simpson like
when he's
like
is that
this.
a meme?
He goes into the bushes. That's how
Maybe that's part of it. I don't know. But that I think that description deserves its whole long.
stay tuned. Then.
Yeah, that'll come later on,
All
Doug.
right.
But
Well, thanks for allowing me to nerd out. I love nerding out.
I love hearing you guys nerd out. That makes me happy.
We're going to keep nerding out and driving things to heights never seen before. Let's go.
I love it. Big things.
Thanks.
Thanks, guys. Appreciate it. Bye.